Diabetes is often thought of only in terms of diet plans, medicines, and blood sugar readings, but its influence goes far beyond numbers on a chart. Living with diabetes can sometimes feel overwhelming, bringing with it not just physical challenges but also emotional and mental stress that quietly impacts the overall well being. Shows that people with diabetes are more prone to experiencing stress, anxiety, and depression, which in turn can affect blood sugar control and long term health. This creates a cycle where emotional health and physical health are deeply interconnected. In this enlightening session, Dr. Sunil Gupta will explore the often overlooked dimension of happiness in diabetes, how positivity, mental balance, and a joyful outcome can play a powerful role in better diabetes management and improve quality of life. Dr. Sunil Gupta is a renowned diabetologist with decades of dedicated work in the field of diabetes care and research. He has been instrumental in advancing diabetes management practices in India and has contributed extensively to improving patient awareness, education, and holistic well being as the director and chief consultant at Sunil's Diabetes Care and Research Center, Nagpur. Dr. Gupta has guided thousands of patients towards better diabetes control and healthier living. A passionate academic and researcher, Dr. Gupta has authored multiple research papers and actively participated in national and international conferences on diabetes, lifestyle medicine, and preventive health. His work emphasizes not only the medical aspects of diabetes but also the psychological and emotional dimensions that impact the quality of life. In today's session, he will share his insights on happiness in diabetes, highlighting how emotional well-being, positivity, and a balanced lifestyle can play a vital role in effective diabetes management. Doctor, now we'll start with your questions. Doctor, your volume is off, I guess. Yeah.
Yeah.
So, how does emotional well being directly influence blood sugar control and overall diabetes management?
Now, Meeta Madam, thank you very much, and thank you Beyond Sugar for this particular CME today. It's a Facebook Live and YouTube Live program which any one of you can certainly listen. And this is a topic which is utmost important to for anyone who has a brand or who has a tappa of diabetes. May it be a type 1 diabetes, may it be a type 2 diabetes, may it be a gestational diabetes, but the diabetes distress is a new area of research, and many of us are still learning how do we really go ahead with these type of cases. And let me tell our audience here, almost 50%. That means every second person with diabetes may have some kind of stress, and that stress could be related to anything. Could be related to your lifestyle, could be related to the therapy related, could be related to the complications if you have, and could also be sometimes psychological impact of various other non-diabetic reasons which could be responsible for it, which will again get further exacerbated because of hyperglycemia. And one should know that if you have you are undergoing some kind of distress, some kind of depression, some kind of anxiety, some kind of some stress due to anything, that will certainly have its impact on the blood glucose. It could be multiple things. It could be simple acute stress. Say someone you lose, to whom you used to love a lot, irrespective of the relation. But if you someone who you have you lost suddenly, and your blood glucose suddenly goes up. Suppose someone you have got heart attack and you get admitted in a ICU, and a doctor says, oh, your blood sugar has gone to 500.
Hmm.
But doctor, when that 10 days back, I have checked my blood sugar. It was normal, almost normal. It was 110 and 160 and 180. It never goes up. Your HbA1c, if you see, it is always 6.57. But how my blood glucose has gone up in the ICU when I got admitted for the heart attack? So these are all acute stresses
Yeah.
which can have its impact on the blood glucose. It can cause, second, it could be even sometimes complication related, like hypoglycemia.
Yeah.
So if you have one simple moderate to severe kind of hypoglycemia, you remain in stress with in a background of your mind that it should not happen that I might develop hypoglycemia in the night when I am in sleep.
Mm-hmm.
My and will it also affect my kind of, I might land up into unconsciousness and coma when I'm in sleep. And that's why they go for defensive snacking, and defensive snacking is another very psychological condition which is commonly seen in, especially in children with type 1 diabetes who are on multiple doses of insulin therapy. So it will depend from one person to another. It will depend from one situation to another. It will depend from one type of diabetes to another. It will depend on multiple other factors.
Yes.
First is you yourself, who are being pampered by everyone. Second, the other person who means pampered means you could be pampered, or you could be just isolated. Sometimes I always say, Meeta madam, that someone comes to me with a family, husband, wife, and wife says, I have to prepare his food separately. I always discourage this. I
Yeah.
said, why not a diabetes diet which is fit for everyone? If he has diabetes, you also stop sugar. Let it be a family one meal, one food things, or one kind of diet across the full family. You are a family of three or four people or five people. Now, most of them are nuclear family. Some of them they have their parents and grandparents, like I have. But then most of them they have their families, which is nuclear family.
Mm-hmm.
Out of the three or four people, if you prepare separately for a person with diabetes, also will have its indirect impact on the mindset of these people. Oh, I'll have to wait. I'll not get that sweets. He will, and then, and if you bring some sweets there in the house, then again it will have an indirect pressure of this stress. So a lot of such situational things might happen. Even insulin distress is another one big area, Mita Madam.
Okay.
See, once the moment, see, one thing is very, very clear. Now, every listener here should know about one very basic thing about insulin.
Yeah.
Every type 1 diabetes have to be on 4 times a day insulin therapy, breakfast, lunch, dinner, and bedtime
Mm-hmm.
throughout their life.
Yeah.
One thing. Practically, every person with type 2 diabetes sooner or later will need insulin therapy. More they survive longer, higher is the chances of having requirement of insulin in future. 50% of them, 90% of them may need insulin within 14 years of duration of diabetes. And rest of the 10% will also need it after 15, 18, 20, 25 years of diabetes. So if you are mentally preparing yourself from the day one, once you are being stamped to have type 2 diabetes, that I'll need insulin, then that will not cause stress.
Yeah.
But the moment insulin comes, because mentally they are not prepared, and many of times it's we doctors fail to communicate this to the patients. We say, no, no, your diabetes is tablet wala diabetes. You will not need insulin therapy. So if you come out with such versions, then it becomes a kind of, that becomes a mindset of a person that I'm a tablet wala diabetes, I'll not need insulin. Any can, you have got some emergency, you have some surgery, you will need insulin. Some women gets pregnant with type 2 diabetes, she will need insulin during pregnancy. Any small operation, cataract surgery, not getting operated because of the uncontrolled blood sugar, they will need insulin. Any acute emergency, you will need insulin. So insulin is thing which will be there for every diabetes person. They should be mentally prepared to have this. But unfortunately, this awareness amongst people is missing out, and that is why our people, they really take a lot of stress the moment you talk about insulin. Multiple myths in their mind. I'll tell you,
Yeah.
multiple myths. First myth: once insulin, always insulin.
Mm-hmm.
That's the
yeah,
first myth. And there is a situation in type 2 diabetes where if we give insulin for short period, suppose someone, Mita madam, comes to you for the first time, some with fasting 250, postprandial 350, with history of weight loss, say for 3, 4, 5 kg weight loss, some infections, coming to you for the first time with HbA1c of say 11, 12. In such situation, we do give insulin for short period. We know it is type 2 diabetes. Now, this short period insulin, the moment you say, oh, you have to take insulin for 4 to 6 weeks only, it will be good. Uh, why insulin? Am I so bad? Am I so serious? I am to roaming around. So that causes stress. But if you counsel them well, see, your beta cells have got highly exhausted. And to give rest to these beta cells, you have to give insulin for short period. I'll always give a example of a some of the maid at your home. If some maid becomes very serious, what will you say? Okay, okay, you go and take rest for 1 week and come back once you are all fit to join duty. Similarly, your beta cells are highly exhausted, your pancreas is highly exhausted, your blood sugars are very high, you have got lost your weight, you have got some infection. We need to have insulin from outside. We have to get another mate for these 7 days or 4 to 6 weeks, and give rest to the beta cells. Once you get give rest to the beta cells, they will improve their health will improve. They will start excreting insulin, and you will do well with only tablets without even insulin after 3 to 4 or 6 weeks.
yeah,
So, but that stress, if not being counseled well, and if I say, oh, you have to take insulin, then that everything starts. If I don't explain, so
yeah,
you have to have a good communication, good counseling. A happiness has to be a part of it. Is a right.
yes,
Everyone, whether diabetes, non-diabetes, of a right. We need to remain happy, but for which your doctor also should behave with pleasure and happiness. Even the negative thing you have to tell with full positivity around. So the things will get settled. But if if you come to me with say some relative, Dr. Gupta have come to you, you usually give a smile, and Dr. Gupta have come to meet you for the first time. And if I say yes, yes. This is if I give very blank face to the person, then possibly that's not a very welcome gesture.
yeah,
Stress. So even a doctor has to remain happy while counseling. Happy does not mean laughing and all that, but your body language should be more on a positive direction. So today only one young girl of around 34 came with father, and she got herself also tested that doctor, my father is diabetes, he's on insulin. So I thought I'll also get it checked. I said, "Oh, okay, you get it checked." She got the report that was 7.2, and she was shocked. Now I've developed diabetes. I said, congratulations. She
yeah,
said, why congratulations, sir? I said, congratulations, because from today, she has little obese. Huh? I said, today onwards, your life will have discipline, which was not there earlier.
yeah,
So, diabetes actually makes you disciplined. And this positivity of accepting the diabetes makes a lot of difference in the people with diabetes, about their compliance, about their habits of eating, about their complaints about diet, complaints about exercise, complaints about some meditation, complaints about taking regular medication, compliance about your monitoring, compliance about your visits to a clinic. Everything will be very, very positive once you start with this. Like, I, today, she's so happy, sir. Why you are saying about discipline? I said, now, up till now, are you going for exercise? She said, no. Are you following diet? No, sir. Are you taking low fast food and all? Yes, sir. I do take every week, at least twice a week. I call for the pizzas and burgers. I said, all these things now will get streamlined,
yeah,
and you will now become more disciplined towards yourself and to your health. And once you go for regular exercise and meditation, that will also secrete some happy hormones in you, and you will become happy. So diabetes is a condition. I don't call it a disease. It's a condition which teaches you discipline. And once you learn discipline, then I feel, see, it's exactly like going to a school. Whether you take as a stress of that I have to go to 9 a.m. in the morning, or whether you happily go, no, no, I'll go at 8:30, 8:45 and sit in the, so, of yourself, and go in this to the school and enjoy every moment spent in the school. So it's all up to us. And for doing so, doctor fraternity need to be more positive for education. And many of the times we are too busy for education, most of the doctors. Too much rush in the OPD. Sometimes you give hardly 5 to 7 minutes to the patient, and then the communication remains, and most of the thing discussion is only on the symptoms. Okay, I have got infection, I have got headache, I have got burning feet, I have got this, my blood sugar. No other discussion on happiness and the distress or psychological aspect of the diabetes. Behavioral changes, we don't talk on this. Sexual dysfunction, we don't talk on this. And this sex is one of the things which if remain untouched,
Hmm.
that can create much more distress versus any other condition.
Yeah.
And that will be a distress which remain untouched in most of the clinics.
Yeah.
So one should now learn to talk. Every healthcare profession should learn to talk on sexual life of a person. That should not only be for the men, but also for women. So even that is also equally important. Interpersonal relationships gets affected badly because of the this physiological need of a human being. So
Yeah.
one should always be and for this we have an educator.
Yeah.
So now we have a system, and this system now should be incorporated in most of the clinics. Most of them have incorporated that, you, because doctor don't have time, so you have a counselor or a diabetes educators which do wonderful job. Good nurses, good quality nurses can become a wonderful educator, and they also can help your patient to coming out the stress. Many of the people with diabetes, when they come to my clinic, they discuss 10, 15, 20, 30 minutes outside my chamber with them, and my educator comes back and says, sir, please talk to their mother-in-law, she is not cooperating, you know. So they will tell everything to her, and then sometimes they come, sir, he is very much in the stress, he will not disclose his habits, he is taking tobacco, he is taking gutka, he is taking alcohol, but he always denies. So I get this message through the educators.
Yeah.
Are you getting this? So you can have a good system where you have a doctor, you have a diabetes counselor or diabetes educator, you have good nurses, you have good family members who can be trained as an educator.
Yeah.
So family support is equally important. I always say diabetes care is a 24 by 7 job.
Definitely.
And
Definitely.
the reward is not immediate. Reward will be only in the long term, that you don't develop complications, you don't develop retinopathy, nephropathy, neuropathy, you don't develop this. So basically, it's a 24 by 7. It's not unlike your job or my job, that you come and you get Saturday evening and Sunday holidays. This life is not only without holidays. You have to be 24 by 7 on job for diabetes, for everything. Yes.
So,
Your question was very too small and my answers were too big, actually.
no, it was very well elaborated.
Yeah, yeah.
So, my next question is, what are some practical strategies people with diabetes can use for daily use to reduce stress and maintain a positive mindset, doctor?
I feel the first thing, you have to take it very, very positive. Once you develop diabetes, or once you, even if you have some complication, take it that is a part. Today only, I again give an example to you. One person came to me, and he said, sir, I'm sorry, I've come to you after 1.5 year, but I was badly disturbed. I said, what happened? He said, my wife is admitted in ICU, nearby ICU, and how is she now? She is good now. So I said, what's her age? He said, my age is around 62, 63, my wife is around 58 or so. So I said, see, gone those days when you used to listen only one statements in the society, that palana palana one, that person was all good yesterday evening, and today morning we heard that the person has got something and he died. Now things, we are all living in the evidence based, very high level of quality care in the medical fraternity, and that is why the life expectancy of all of us have improved. And to have a better quality of life, If your wife is admitted in ICU for a care, let her undergo all good quality care. You have faith on the doctor, he said yes. You have faith on ICU, I said. You have faith on your wife, he said yes. So with your faith on everything, let the destiny be decide about everything, and you be very positive that your wife will be all fine within few days. Why do you worry about it? For which, why are you disturbing your blood glucose? Are you getting this? So it is all, your job was that you were from 500 kilometers from here and from Anuppur, which is a near Chhattisgarh, near last part of the in the border, and and you have come all the way from 700 kilometers to Nagpur to get admitted your wife into ICU. Now you should be comfortable that you did your job. You are ready to do everything for us. That's how satisfaction should come, and you should remain happy. And if you remain, with a very depressed face, your wife will not get an encouragement. You always say, oh, today you are looking very fresh. Go to the ICU and say, smile, big smile. Say you are looking very fresh. Oh, you had one chapati yesterday, you did not had anything. Good, you are looking great, you are looking energetic. Something like this. So positivity should come from within, and this should also be sometimes taught to the people with diabetes. So we should, of course, uh, doctors should remain happy for this. What your question says. Second is, of course, you should have educator. We should also be energetic in educating people. And communication, madam, the most important lacuna in our field is communication.
Yeah.
And this communication on a very, very healthy note, if someone does, then I don't think there will be any problem of depression. Of course, this 47%, there could be some inherent things. Apart from those 10-20%, the rest of the things can certainly be tackled just by discussion, communication. We have one wonderful buffer system for type 1 diabetes. I'll tell you that.
Yeah.
For type 1 diabetes, the moment some child, say of 5 years of age, who was all playing, doing everything till yesterday, suddenly someone says diabetes and everything stops. All sweets, no too much of care taking, too much of insulin, 4 pricks of insulin per day throughout the life. All these things causes pain and distress in the parents and the grandparents, and even all other children who are there at home, or every family member. Now this kind of change in life can certainly cause distress. Once they come to us, what we have done, madam, we have actually created a system where we have a group of JDs, or juvenile diabetic, those who are having diabetes since 20 years, 30 years, 35 years. So it's a system with us. Any type 1 diabetes enters in the center, he is usually there for 3 to 4 hours. Sometimes they get admitted. We call these group of people, they come leaving all their personal things. They will come, 2 or 3 people will come, will sit that with that person, will we meet their parents, and we'll try to give them the examples, like a, my role model kind of thing. See, my child is diabetes since 21 years. Now she got married and she got child also. So nothing happened, everything is, you have to just do this, you have to just do this. So this kind of a buffer system
Yeah.
for everyone. Same is with pregnancy diabetes. Give a role model to a good pregnant diabetic woman who had multiple daily doses of insulin, and who had missed abortion for four to five times, and was not having infertility for 3 to 5, 10 years, and suddenly got pregnant with diabetes, and get wonderful treatment from a good clinician, and then comes back with a child, with a normal child and normal pregnancy, and this becomes a role model for other pregnant women who are depressed because of infertility, because of diabetes. They are not getting conceived and not getting baby. So these role model, or a buffer system also need to be developed by each and every clinician, because you have such patients, you have treated them, they are there with you. But if you can develop them, or if not, you can simply prepare few of the testimonials for yourself, and can also use them as and when required.
That's a very good point, doctor. Very well. Okay, doctor, can practices like mindfulness, meditation, or gratitude journaling or genuinely improve diabetes outcomes? And if so, how?
Madam, this is a very valid question. See, let me tell you, 15 years from 20 years from now, when I started practice almost 35 years back, 1994. That's 32 years. And 1990, I passed out my MD medicine. And from that, the training 1991. So almost 35 years, if you see. Early stages of my career in practice, I used to say, we don't have a data, we don't have the evidences whether X therapy or Y therapy or Z therapy will work or will not work. But when it comes to yoga, we used to say, you to try, you might get the benefit, may not. But now meditation, like yoga practices, have come out with the scientific data available. And that scientific data has clearly shown that you have good number of patients with type 2 diabetes. They are being benefited, not may not be for everyone, but good number are being benefited. And also there are some inflammatory markers comes down. Inflammatory hormones, means that those bad hormones also comes down. Counter regulation comes down. Their fitness and improves. Their sense of well-being improves. So a lot of good things happens when you practice any meditation, which might include yoga. And so yoga practices is one thing which is scientifically can is proved. Similarly, many of the meditation practices are also being have been done in a small studies. May not be a very large scale trials, but small studies, they have again shown some kind of meditation, some kind of yoga might help in few people. And we should certainly support such things. If you have seen some patient coming to you with this stress. And one very important thing, I'm using the word patient. Ideally, I should not use it, neither you should
Yeah.
use,
Yeah.
because calling patient itself give a distress.
Yeah,
We call
definitely.
them as people with diabetes, PWD, people with diabetes. It's a group. If it is a
Yeah,
person, it's a person with diabetes. So that's another indirect way of call reducing their stress.
definitely. So, doctor, why is it important for healthcare providers to address emotional health alongside physical health in diabetes care?
Madam, it is all interdependent. If you have stress, you are likely to have uncontrolled blood glucose. If you have stress, you are less likely to do their monitoring. You are less likely to be compliant to your diet, exercise pattern, and other things. You are less likely to be visiting to your concerned doctors because of this stress. So the moment your stress level comes down through any mean, simply by counseling, simply through educators, by meditation, by yoga, or by any mean, your everything, your compliance for everything improves, what I told you. And once the compliance for every part of the diabetes care, there are four pillars, no, we say diet, exercise, medications, and monitoring. The four pillars. And the tabletop is education. So this tabletop with four pillars will get justified once you don't have any stress. So that justification needs these people to be identified and need these people to be counseled that they should come out of it. So certainly it will have its impact on the blood sugar management. Complications may deteriorate. More amount of hypoglycemia and hyperglycemia. Sometimes in type 1 diabetes, because of the severe stress, you skip insulin therapy and you'll end up into diabetic ketoacidosis. So these are all common things which need to be addressed for.
Okay. What role do family support and social connects play in helping people with diabetes live a happier and healthier life?
Madam, this is at most important. I feel everyone is aware of it. Unfortunately, we have now nuclear families, but when you used to have a joint family, I have a joint family still, but when you have a joint family, then you have wonderful buffer system. Even today, when I go back home in the night, my mamas and my father waits for me and for the dinner. We have together dinner. Morning hours again, I'll have a cup of tea only with my parents and my wife and my mother. So all these things are at most important. Family support, friend support, somewhere you are doing job and your colleagues around who are your close people. So not necessarily it should be a blood relative person. It can be even anyone who's a well wisher, anyone who's close to you. Sometimes I have found your childhood friends, they become a wonderful buffer for you throughout. You can go once in 3 months, 6 months, once in a year. and then go and finish up distribute, means, sharing all your those negative things, and they become a guide for you. So family support, all friends support, even about this type 1 diabetes I was talking about. Nowadays we have started preparing uh, type 1 diabetes mothers and their relatives or sisters as diabetes educators.
Okay.
So once they become diabetes educator, they can not only take care of their own child, but also other child and other parents. So that is another thing. And of course, they are being taught about the evidence-based medicine. We run a course called as NDEP, National Diabetes Educator Program, that we are running since almost now 16, 17 years. And we prepare every year. We have a batch of 30, and we they get a certificate, CD, Certified Diabetes Educator, and then they can work across the places and diabetes educators. So now I have included nurses. I'm encouraging them that nurses should become a good diabetes educator. Of course, nutritionists are already there. Some of the doctors of alternative medication medicine, even they want to become a diabetes educator and they want to learn about diabetes. Then last but not the least is relatives of these type 1 diabetes, and even those who are adult type 1 diabetes, they have also done this course for the society. And now I'm focusing on pharmacy people, that they should also be trained as a educator. So we have a wonderful pool of educators across in the society across, who have learned evidence based medicine, who can really answer justified way and satisfy justified way of counseling. And if they do that, that will be an asset for the society as a whole. And that is a kind of mission education. We run our campaign or a mission called as Hello Diabetes Education. Hello Diabetes Education. So
Yeah.
it's mission. It's a mission education. Hello Diabetes Mission Education. So this mission education continues, holding, not only educating our own people or own colleagues from the healthcare system, but also creating such educators from different specialties, and they can become an asset. Very recently, Meeta madam, I have decided, why not to why not to educate the to create educator from the pharmacy background. Now you imagine, remotest place of the country,
Mm-hmm. Yes.
rural, ultra rural, you have a chemist.
Yeah.
Government is very strict that you want to have a chemist who has a B Farm degree, the science background, and or D Farm degree. Unless and until you have that certificate, you can't sell any medicine from there. Now, unfortunately, this big chunk of people are still untouched. And if we teach and if we educate or become a create educator from that ground, then even a rule is, place where remotest place of the country can be addressed with good quality communication of diabetes management. And simple few words: oh, insulin is one of the best treatment. Oh,
Yeah.
you got the glucometer, you should have a glucometer. You should are you testing your blood glucose regularly? When the person comes to take the medicine to your shop, yeah, are you taking your blood glucose checkup daily? You are doing it or not? You should not. You have glucometer? No, I don't have. Since when you are diabetes? 10 years. Oh, you don't have glucometer at home. You are taking insulin without monitoring. Not good. Why don't you go for it? These simple things, and that will cause. Oh, you have got chest pain. Don't put just the ointment. वो जो advertisement आता है वैसा, या you don't take that powder of the acidity powder. Don't do that. Go to a doctor, because diabetes may not have typical chest pain of heart attack.
Yeah.
So such a small teaching, such a small clues, like we are not doing CPR training for our youngsters. That again is wonderful thing in the society. And at least I was told about a figure around 63 lives have been saved through those people who have been taught about the CPR training. One of the person who's doing it. So they told me, sir, across the country they get the datas. So those common men, those who are not aware of the non-doctors, they have saved at least 63 lives across the country through those after that training. So like this, I feel we need to have a support system with us now.
Definitely. Doctor, it is a very cohesive approach that you have, and I'm really happy to know about it. So, as we wrap up today's session on happiness and diabetes, a heartfelt thank you to Dr. Sunil Gupta for sharing his invaluable insights. His perspective has reminded us that diabetes management is not only about medicines and numbers, but also about nurturing emotional well being and finding balance and embracing positivity in everyday life. To our wonderful audience, thank you for being part of this conversation. We hope today's discussion has inspired you to look at diabetes with a fresh perspective, one of that includes joy, mindfulness, and the simple practice that can make living with diabetes more fulfilling. Stay connected with us for more such enlightening sessions with lead experts. Until next time, take care of your health and keep your spirits high. And remember, happiness truly plays a role in diabetes care. Don't forget to follow us on a social media handle for more such tips and updates. Thank you.
Thank you.